Assalamu alaikum. We will start our today's session. We have patient named Miss Zahra, 25 years, with complaint of back pain. We will start after the timer. Hmm.
Okay.
Sorry, no, this is the, yeah, reset, stopwatch. Okay, ready.
Okay. Hello.
Hello.
Hi. Good evening. This is Dr. Turkawi. I'm one of the doctors in the ward today. Am I speaking to Ms. Zahra?
Yeah, yeah, I am.
And you're 25 years old.
Yeah, doctor, I am.
Okay. So Ms. Zahra, can you tell me? I understand that you came with back pain. Do you want to tell me more about it, please?
Yeah, doctor. Recently I had this back pain, and it worse all the time.
Mm. When did it start exactly?
2 weeks back, but I noticed it's worsening.
It's getting worse. Okay. And 2 weeks back it started. It's continue going for 2 weeks non-stop.
Yeah, doctor, it's not going at all, but some resolve when I take
Some
painkiller.
result. Mm. When you take painkillers, what painkillers do you take?
Paracetamol.
Okay. And did it happen all of a sudden or
No, gradually.
gradual? Okay. And do you think you hurt your back? Have you had any traumas before the
No,
back pain?
never, doctor, never.
No, not at all. Okay. So it happened gradually. What about the
Mhm.
score if I ask you to score the pain from 0 to 10?
Yeah, around 5 to 6, doctor.
Okay, I'm sorry. Um,
That's it.
and paracetamol works with the pain. What else makes the pain better?
The rest, doctor.
Rest. Okay. So let's make it better.
Yeah.
Um, and have you had this pain before the 2 weeks?
No, no, no.
Never. Do you have any pain, joint pain anywhere else other than the back?
Sometimes in the bones, yeah,
In the bones.
in my leg, doctor, and my thigh, and
Mm,
sometime in the hip, like this.
okay. In the head, you mean headache?
Hip, my hip,
In the hip.
my waist.
Oh,
Yeah.
okay. What about so you don't have any joint pain, other joint pain? You said you have sometimes in the hip and
Yeah, sometimes I feel hip
okay.
pain.
Do you have any weakness
Uh, yeah, sometimes as well. I have this
in your
weakness
leg?
in my, yeah, especially
Mm,
in this area of my waist. I can't stand from sitting like that. It's difficult
okay.
for me.
Difficult for you. Is it because of the pain or you feel weak?
Yeah, because of the pain in the bone.
Okay. What about numbness? Do you have any numbness
No,
in your legs? Any loss of bowel control
no, doctor.
or water
No,
control?
no.
Okay. And what about rash? Do you have any type of rash?
Yeah, doctor. I noticed some rash here in my elbow.
Can I see the rash?
Yeah, doctor. I will show you.
Okay. So meanwhile, do you have any tiredness or feeling fatigue?
Uh, Sometimes, yes, doctor, I'm not feeling power and my energy is less.
Hmm. Okay. Um, and the
Yeah.
rash, when did it start?
Rash appears on and off, doctor.
Mm.
I
What do
will
you know
share it in
what
the book.
brings the rash?
Yeah, it's in the elbow, sometimes in the knees.
Do you have a diagnosis for this rash?
No, doctor, I didn't ask for
Okay. Do
medical
you take
advice.
medications for it?
No, doctor, I did not.
And do you take any medications at all? Any steroids, for example?
No, doctor.
Okay. Uh, any creams for the rash?
Yeah, I use some sunblock, but it doesn't help. This is the rash, doctor.
Mm. Okay. And you have the rash in your knees as well?
Yeah,
Okay. Any rash behind your ears?
no,
Any rash in your scalp?
no.
Okay, any silver scaly rash?
No, doctor.
And you don't take any creams for this medication, for this rash?
I told you sunblock, doctor. I thought it's related to the sun, but it doesn't help.
Mm. Okay, it doesn't help. Okay, is it
Yeah,
itchy?
yeah, doctor, too much.
Okay, all right. And you said it comes on and off. What brings it? Is it like certain materials or
It
certain?
No, no, doctor. From the pharmacy, I asked him for some. Can you give me the sunblock?
No, what brings the rash?
Drinks?
What
Bring
brings
the
it?
rash?
Yeah.
I don't know, doctor. It's sudden appear, and I don't know what exactly. Not no
Okay.
particular, doctor. I don't know.
Okay. Are you allergic to any medication?
No, 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 at all.
Do you have any medical condition at all?
No, doctor.
You're not there. Are you seeing the doctors for any or and the nurses for any condition?
No, only the pharmacy. I show him this rash, and he give me this.
The sunblock.
Yeah.
Okay. And when did he give you the sunblock?
1 month back, but it doesn't help or didn't help.
Okay. All right. And what about any other symptoms? So do you have any breathlessness or feeling?
No, no,
Any chest pain?
no.
No. Any tenderness in the back?
Yeah, doctor. The same area of where I feel some pain.
Mm. Okay. And did you notice any weight change?
Yeah, doctor. I'm not gaining weight.
You're gaining weight.
I'm not gaining weight.
So are you losing weight or you just not gaining weight?
Not gaining, yes.
Okay. Are you trying to gain weight?
I eat well, doctor, but I
Mm.
noticed that it's not gaining it.
Any any vomiting?
Sorry.
Any vomiting?
No, doctor. No throw up.
Okay. Any how is your period?
Yeah, doctor. I suffer from this problem. I don't have period.
You don't have periods.
Mhm.
And um can I see you? Is there any chance like I can see the patient? Is there any characteristic while I'm talking to the patient? Is she short, wide neck?
No, no, no.
Do you
She
know why
is
you don't have
normal.
period? But she's what? I'm
I
sorry.
don't know. It was there, doctor, but for the last 3 months, it
Mm,
disappeared.
okay. Is there any chance that you can be pregnant?
No, doctor.
No.
I did the test.
You did the test. Okay. And you're losing weight. Any shakiness of your hands?
No,
Any preferring of certain weather?
no, no, doctor.
Any loose motions?
Yes, doctor. I have this loose motion since long time.
Mm. You have tummy pain sometimes?
Yeah, as well. Yes.
Okay. All right. And what about pills?
No, no, I don't take, doctor. I don't take any pills. You mean for
Mm.
the birth control? No, I
Yes.
didn't take.
Okay. And what about smoking?
No, I'm not.
You don't smoke alcohol?
Yes, I noticed, doctor, that I cannot tolerate this alcohol. So that's why I quit alcohol.
What do you mean you cannot tolerate it?
Yeah, there is loose motion with this alcohol,
Mm. Okay.
with the beer.
And I'm just going to examine you, and I might ask you further questions while I'm examining you. Is
Yeah,
that okay? Do you have
sure,
any family
sure.
history of any similar conditions?
My mother was having what's called irritable or sorry, inflammatory bowel disease, Crohn's.
Mm. Mm. Okay. And all right. Okay. So I'm just gonna have a look at your hands.
Yeah, the hand,
I'm looking at the patient. Is she cachectic?
yes, little bit underweight,
Mm. Mm.
and the hand like slightly pale,
Yes.
and the pulse little weak.
Okay. All right. Is there any leukemia in the? She's pale, so there is leukemia. Uh, Proximal myopathy. So I'm just gonna examine the patient's arms. Can she resist me up?
Yeah, some weak, but she can do it. The power
Okay.
is okay.
Yeah. And the eyes are pale. Is there anything else? Redness or yellowish
No
discoloration?
redness, no
Mm.
yellowish discoloration, some pallor.
Mm. What about the face? Is there any rash in the face?
Not in the face, no in the face rash.
What What about the mouth?
Yeah, there is mouth soreness.
There is mouth
Mouth
sore.
sores.
Okay.
Yeah.
And uh so Miss Zahra, you told me that you have diarrhea, and it has been going on for a while now. Is it
Mhm.
associated with certain type of food or?
Yeah, doctor, I noticed that whenever I eat pizza or
Mm,
pasta, it
mm,
comes more and more.
mm. Okay. And are you seeing anyone for this? You seeking medical advice or?
No, but I read just to have certain change the food. It might help,
Mm,
and it helped with me.
okay.
But doctor, I want to eat pizza. That's why I'm just avoiding. But again, I'm eating it.
Okay. Um, yeah, we will talk about this by the end of the of
Uh-huh.
our consultation today. Um, Also, what else is there? What else do you have other than the diarrhea? Is it bloody? There is any blood in the diarrhea?
No, 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 no blood, doctor.
Mucus,
Yeah, doctor, I noticed there is slime,
slimy, yeah.
slime. Yeah.
Okay, all right. And you said you've never been sick at all. You
No,
don't feel
doctor.
no vomiting. Okay. All right. So I'm just gonna look at this rash. It doesn't look like there is any discharges or it's not hot. It's just red rash, right? In the elbow
Vesicular,
joint.
yeah.
Yeah,
Vesicles,
underneath.
yes. And
Yes.
itchy,
Okay.
yes.
Itchy. Okay. So if there are some scratch mark around the rash.
Yeah.
Abdomen. Is there any hepatomegaly?
No,
No. Okay. Just listening to the back of the chest. Any basal crepitations? Fine.
no.
No. And heart and epic speeds and everything is okay.
Yeah.
Um, no murmur, no anemic murmur or flow murmur or anything.
It's mild functional memory, yes,
Okay,
but
all
not
right.
significant. Yeah.
Okay, and now I'm looking at the knees, examining the rash again. It's similar to the one in the
The
elbows.
same. Same,
Yes.
no change. Yeah.
Any leg swelling?
Neck swelling, no.
No. Okay. Um, so what do you do for a living, Miss Zahra?
I'm student, doctor.
Okay, and how is this back pain and everything you're going through affecting your life? It must be
Yeah.
difficult to
Yeah,
deal with.
doctor. It hurt me, doctor. Yes.
Mm. Okay, and is your loose motions and weight loss, are they affecting your life as well, or you're coping with it?
Yeah, I'm trying to compensate. I'm drinking more water, juices like that.
Mhm. How often do you have the diarrhea? How many times per day, if you can say approximately on an average day?
Around, yeah, maybe 4 times, doctor.
Mm,
Especially when I eat this pizza
mm.
or pasta
And who do you live with?
with my
With your
family,
mom here?
my father, my mother.
Mm. And okay, all right. And what are your concerns? Um,
Why all these things with me, doctor? The back
mm,
pain, this
mm.
rash. Help me, doctor.
Okay. Yeah, so this is a very it's a genuine question and it's a very valid concern. Um, it must be you seem to be struggling with your back pain and all these symptoms,
Hmm.
and it must be affecting your life. So I believe what you have is a complication or it's one of the things that usually associate with a condition called celiac disease. So you probably have vitamin D deficiency, um, causing all this back pain, muscle pain, the loose motions that you have that are usually associated with pasta and bread
Pizza
and
and
pizza
bread, yes.
are usually most likely to be a condition called celiac. However, to confirm this, we will need to do blood tests. We need to take a sample of your stool. We will need to do some imaging, and we might also need to take a small piece, a small sample, which we call biopsy from your tummy
Hmm.
to confirm the diagnosis. However,
Hmm.
for now, um, For the sake of the investigation, we might ask you to continue the same diet. However, after we take the samples, we will need you to try to stop the pasta and the pizza and all the food that contains wheat, because it will help you. You will need
Oh,
we will need to do
o-
imaging to your back,
okay.
to just confirm if there is any fractures or if there is any pain. Oh, I need to examine the back. Oh my God. Any tenderness or
Okay.
scar?
Yeah, there is some tenderness
Mm,
and yeah, in the lower part of the back and in the hip as well.
okay. Yeah, so all these things come together. They can actually form, as I said, the celiac disease and its complications. We
Mhm.
might be looking at some fractures in your spine. Do you drive, Miss Zahra?
No, doctor, I am not.
No, okay. That's good. So for now, as I said, we need the imaging, we need to confirm the diagnosis, and then we will take it from there. I will speak to you after the blood tests and the investigations results.
Okay. Yeah, doctor. Doctor, I traveled last month with my colleagues, and after this travel, I noticed also this loose motion become more. Is it related to the travel?
It can be, yes, it can be related. Oh my God.
Okay. Time is
Okay.
up. Yeah, this question just to
Yes.
yeah to remind you.
Mm.
So whenever there is some possibility of infection, ask for the travel. Okay. Let's present the case, please.
Okay, so Zahra is a 25 years old lady presented with back pain for the past 2 weeks that was associated with tenderness, got worse with movement, and I got better with rest. She also had symptoms of celiac disease, evidenced by the loose motions and the weight loss. She looked anemic. All these symptoms associated and made worse by the pizza, pasta, and all the wheat-containing food. Zahra also had a rash. I believe it looks like dermatitis herpetiformis,
Mhm.
which is one of the rashes that are associated with celiac disease.
Okay. What about hair amenorrhea? Do you think
Uh,
it's related?
it can be related, probably malnutrition.
Mhm. Okay. So how are you going to investigate Zahra?
Okay, I would start by confirming the
Sorry,
diagnosis.
before investigation, sorry. Give me the differential. Three differential diagnoses.
All right. So the differential, as I said, is for the back pain. For the condition as a whole, it could be any malabsorption syndrome that can present with the same symptoms. So celiac disease can
Okay.
also be ripples or any post infectious malabsorption syndrome. The back pain, it sounds to be non-inflammatory. So I would be looking at fractures or vitamin B deficiency. Can also be muscular pain. Um,
So stimulatia, you mentioned vitamin D, right? So you mean stimulatia, right?
Osteomalacia. Yeah.
Yeah. Do you think about osteoporosis?
Osteoporosis. Yeah. So osteomalacia, osteoporosis, and muscular pain also can
Okay.
be in the differential.
Okay. Let's do the investigation.
Okay. So I will need to do urgent investigation. So Miss Zahra is 25. She had the back pain. I will start by doing the full blood count and X-ray to the back.
Mhm.
Basic blood, sorry, which in the form of full blood count, looking for anemia or any signs of infection. Renal function test and liver function test as well, looking
Okay.
for any autoimmune conditions. I will
But a
need an
second,
X-ray to
please.
the
A
back and
second.
MRI.
Yeah. Before going to the image, what kind of anemia you could find in this patient?
It can be both. It can be microcytic anemia, which is anemia of chronic disease, iron deficiency, but it can also be macrocytic autoimmune anemia, like pernicious anemia.
Related to what? Yeah, pernicious, this is different as an autoimmune. Yes, you're right.
Yes.
Okay, why macrocytic anemia in this patient?
Vitamin B12 deficiency.
What else?
Um, Folic acid.
Excellent. Okay, now tell me the other investigation and imaging.
Okay, so as I said, I will need an X-ray to the back,
X-ray.
and an MRI
Okay.
scan as well.
Uh-huh.
Um, um,
Only back will you do for the humerus? Sorry, for the femur. Do you think you might need it? Because she
as
has
in
hip
for
pain. I mean the pelvis and
AVN.
yeah,
Yeah.
pelvis, yeah, hip and femur. Okay.
Okay. Yeah. I
And
probably
yes, what else as image?
um CT abdomen
Or is it CT
endoscopy.
or okay, endoscopy for?
Yeah. For the abdomen, looking for any gross changes in the intestine.
So
Um,
yeah, what you might find.
I probably might not find anything in macroscopically.
You know, by doing biopsy, what you will find.
I would find atrophied villi.
Excellent, yes.
No,
So you will have finding, not normal.
but that in the
Okay,
biopsy. Yeah, but macro
okay. What else you will do investigation? Will you do vitamin
yes, so
screening?
the blood
Yeah, tell
tests.
me
So
all.
the full
Okay,
blood count, renal function test, liver function test. I would do vitamin
okay,
B12 assay, and autoimmune screening if I felt the need to. We might also need to measure her vitamin D level.
okay.
Um,
What else? Vitamin B only? Which
Vitamin
number?
B and vitamin
Yeah,
B.
yeah. So all
Yeah,
vitamin B, 1, 6, 12, and what else? Folate level. Will you
yeah,
do
folic acid.
vitamin D,
Oh no, I was
parathyroid?
saying vitamin D.
Okay. Calcium. Will you do calcium?
I
Alkaline
will do
phosphatase?
electrolytes, all the electrolytes. Yes,
Yeah, and alkaline phosphatase.
yes.
Okay, so let's talk about management.
Mhm.
How you
We
manage Zahra?
Okay, so I would start by management. So it's going to be a multidisciplinary team management. We'll start by the
Excellent.
non-pharmacological aspect, which is educating her about her condition.
Ex mhm.
Trying to that's for when we if you excluded any fractures or any urgent reason. So we'd be educating her about the celiac disease and referring her to the celiac community, giving her sheets about it, involving GP and community nurses. However, in the case of acute presentation with this back pain, if there is any fractures proven, we will need to involve neurosurgery, discuss with them the query need for dexamethasone, and probably we will involve the gastroenterologist as well. Um, she will
Will you
need,
think will you think it's a fracture or just decreased density?
it
If
can be both.
osteomalacia.
It will depend on the results of the images. If it's
Okay.
osteomalacia, I will think it usually comes with bone pain and muscle pain.
Yeah,
Um, However,
this is the
with the
presentation.
yes, yeah.
Okay. For the disease itself and the rash, give me the management plan.
Okay, so for the disease itself, as I said, trying to cut down the gluten diet, any gluten
Will you
containing diet.
stop will you stop it immediately?
No, as I told the patient, we will not stop
Uh-huh.
immediately. We'll do the blood tests and the biopsy, and then we will ask
Excellent.
her to stop it.
For how long she
Probably
will be
steroids for
stopped?
the rash. 4 to 6 weeks.
6 weeks.
Yeah.
Yes. Okay. Then you will do in this duration you will take the samples, endoscopy, and for the rash, what you will give?
For the rash, steroids. I will start by giving her steroids creams, and then escalate to probably oral steroids or any steroid sparing agents if needed.
For the rash, what you give? Will you give Dapsol?
Steroid and steroid sparing agents.
Dapsol. For the rash, Dapsol. Okay.
Dapsone.
Steroid,
Oh.
yeah, steroid only will give in the celiac if the patient refractory for, I mean, for long time, even with stopping gluten-free diet. You can consider steroid.
Mm,
Apart from this, it has no role. Okay, so for the
mm,
refractory type, and you might give also immune suppressive like azathioprine. Okay, I think it's enough. I extend the time because it's a very common and high yield topic in the exam, especially
mm,
in Europe. Yeah, just to refresh your information and to remind you for certain points. Okay, let's start. I will comment now, okay?
mm,
Yeah. So starting by the complaint, you analyze onset course, duration, the scale of the pain, the exact site of the pain, the hip. I give you the hip, and you can ask me the side exactly where it goes or travel, the pain. I might tell you, yes, it's the hip up to the back, lower back and down to the bone. And you told me what to improve, what to decrease, or what improve, what worse. So it's mechanical one. Yeah, it's not inflammatory pain. I told you with the rest. Okay. And let's go for the constitutional symptoms. You ask me for the weight, for the appetite. I volunteer for appetite, fever and night sweats, lumps or bumps. You didn't ask. However, you ask in the examination for neck swelling. CNS, you ask for pins and needles. I said no, no headache as well. Cardiovascular, chest pain, no, chest short of breath. Endocrine, you ask. The GI. The GI might be before all these systems. I mean, you will analyze more from the mouth sores, difficult of swallowing,
mm,
feeling sick, throwing up. You ask for the
mm,
feelings or throwing up.
mm,
Okay. Then the bowel motion, you should analyze more. Still, the loose motion you didn't tell me about. You didn't ask me about the nature. Is it watery? Is it loose? Is it
mm.
offensive? It's very important.
Yeah.
Containing blood, you ask for me for the blood, but the color, the smell, the amount, the flushability, all this confirmed your diagnosis. Related to the diet, yes, I give this to you. I try to make this case like complex just to be sure that this topic might come with the three presentation, either vitamin deficiency and osteomalacia. It might come as loose motion, and you might find the complication like osteomalacia, and it
Mm,
might come like amenorrhea, hormonal disability or hormonal disturbance, which you could consider in the investigation. You should do also this hormonal assay. Okay, let's go back to the system review. The GI, you didn't ask me about the GI at all. Genitourinary, sorry. The water work,
mm,
any change. You might have associated diabetes with autoimmune. So you should ask about the use either by fourth urine or polyuria, feeling thirsty. The joint pain you covered, the skin rash you covered, and you found that she had dermatitis herpetiformis, and
mm,
you analyze it well by asking for the itching, the oozing, the nature, and the appearance when it appeared. I try to mask you by the sunblock. The female history, you did great. You asked for a period, and I give you also, but you didn't ask me, was it before there? Any medication? You asked me for the OCP, but you didn't analyze for the amenorrhea. Is it primary or secondary? I might tell you it's
No, she said
secondary.
she said it's only 3 months ago that stopped.
So yeah, okay. So
Yeah.
you discover, okay. The family history, I give you Crohn's just to distract you.
You
And the
did?
travel, very important. Yeah, it's clear
Mm.
that
Yeah, yeah,
celiac
yeah, yeah.
from the relation to the food, but please just analyze the loose motion more. The
Mhm.
travel history, very important here. I give it to you like reminder at the end just to make it like last reminder before the exam because you always forgetting this travel, especially with the
Mm.
infection. Try to remember it. You can put traveler diarrhea and patient gastroenteritis, and or you can put also Crohn's with ankylosing. You don't know. You should do ask for the travel. It's very important. You can also think about HIV and infection
Mm.
related. The medical history you ask me, and the medication, the allergy, the surgery you miss. It's okay. The HIV, you didn't ask any HIV question, recreational drug or sharing needles or whatever. The smoking, the alcohol, the job, the driving, you cover all these points. Then your differential in this patient, as you said, osteomalacia, osteoporosis. I could put here also uh, traumatic, but you ask for trauma, so I'm not sure about the third differential for the back pain related to the celiac. We can hear from Dr. Hind.
What was the hip pain? Was it
But
just osteomalacia or?
osteoporosis, osteomalacia, yeah. Sorry? Hello, Dr. Rimaz, what are you saying?
Oh
So
no,
we
I
are,
just said what was it?
yeah,
Yeah,
we
yeah,
are
yeah.
putting differential for the complaint.
Yeah.
Complaint, yeah.
Mm.
I can put inflammatory related to a disease like irritable bowel, or sorry, an inflammatory bowel with enclosing. But
Mm.
again, it's not inflammatory bowel disease. Your examination was okay. You start by the hand, the pallor, the vitals, the rash. You did examine the rash, proximal myopathy, chest and heart for anemia, face, mouth ulcers, the back at the end, and it was the main complaint. Don't repeat it in the exam. Start by the complaint. Where is the back pain? Here. So start the back pain
If
after
the
the
patient,
general look.
so I think what I should do is to be more organized. If the patient gave
Yeah.
me a new complaint, I
Mhm.
should focus on that and analyze it because it's usually it means
Yes,
something.
you.
Yes.
Yeah, you will, but don't forget the main complaint. Patient came with
Mm.
back pain, so this is the main presentation you should
Mm.
do. So
Okay.
please try to, yeah, to remember these points.
Okay.
I want you to get a full mark because
Inshallah.
you're excellent. Yeah, you're
Thank you.
excellent, and your approach much organized than before. But
No, no,
as the
today it wasn't
advice,
organized at all. I was asking you about the abdomen after I finished. So
it's okay.
I wasn't
It's okay.
organized. I should be more, yeah.
Yes, so try to organize the coming days. And the next case, please. Dr. Awatif will give you another case as a volunteer. Analysis. So Dr. Sousan ask you to analyze the diarrhea, please. Vitamin K, also, yeah, one of the possible vitamins to be deficient. Albumin, dapsone for that treatment. Okay. So the celiac, I guess it's the most common in Europe as a loose motion case.
Yeah, yeah,
You
yeah.
should cover it, yeah. And you should
Maybe more
think
common than
more common than
gastroenteritis.
chronic, yeah, inflammatory bowel disease. By
Yeah.
the way, pernicious anemia can be in this patient, yeah, and you can consider the test for pernicious anemia.
Mm.
And yeah, you
The
can put it,
antibody.
yeah, the antibodies. You can put it as an association along with diabetes and other autoimmune. You might also think about vitiligo, but you didn't, it wasn't there, so it's okay if not there. But dermatitis herpetiform, it was the clue of this case.
Mm.
Okay, eye issue as
When I
vitamin
saw her
A
hand, I
deficiency. Mhm.
thought that she had eczema. Before seeing the hand, she said, I have rash. I thought she had eczema.
Yeah.
She's been using a lot of steroids that cause osteoporosis, and that's why she had
Mhm.
the back pain. But then
Another,
she
yeah.
mentioned the area, and I saw the rash. Did it make sense? Yeah.
Yeah, the rash of dermatitis herpetiformis
Yeah, yeah, very
are,
obvious.
yeah, are pathognomonic. You will not forget it.
Yes,
And
yeah.
I remember in UK last or the previous diet, not the previous, the diet before the previous, they brought a case with the rash, the hepatitis herpetiformis, and I guess they put it related to traveler diarrhea, but it was a distractor, and the case was celiac, if I'm not mistaken. If
Mm.
someone remember the case, he can correct. But it's uh, it's important, yes. I mean, celiac as a topic is very important. Not only celiac, the association of celiac. You might reach to the celiac from first question related to the diet. Yes, related to the diet. But what the other association? You might find a lot of this association in this case. I try to put it in one case for you, just to remind for the exam. Hydration status important. Yes, she asked. I for yes, vitamin A. Addison and hypothyroidism and diabetes. Yes, she asked for the neck swelling and weather preference. HIV, TB package. This is for the constitutional. Yes, she should cover also the constitutional.
I have noticed
Okay.
something. I've noticed something in the past test videos, because they
Mhm,
take the history very slowly, and I wonder why don't they ask all these questions that I usually would ask. But I've
mhm,
noticed that after they finish, before the examiner asks them anything, they would say, "I would like to complete my examination, or I would like to complete this consultation by asking the patient about this and that and examining for this and that." So if they missed it, they would just mention that we wanted to do this, but there was no time. So maybe that would be a good
mhm.
idea, a good thing to do.
I don't know. Maybe they
Because
are using a teaching purpose. Maybe they are doing that, just targeting that. You mean targeting or without targeting even the finding?
no,
They are
so
not
for
even?
example, they would say, for example, now we look for tuberculosis, HIV, travel. So
Okay.
if I forgot it in the exam, I would say, I would like to complete
Yeah,
this consultation by asking further
yeah,
about the travel history,
yeah, yeah.
a history of
Hmm.
tuberculosis, contacting HIV, and stuff like that.
Hmm. But you will not put the differential if you didn't ask. You will not put
No,
it
I
in the
wouldn't.
differential.
No, I wouldn't put it in the
Yeah.
differential. No.
So it will matter. I don't know to follow this
I have
pathway.
noticed
Anyway,
this a lot in the consultation
yeah,
videos.
they are finishing early. Yeah, yeah, they are finishing early. Yeah, because they are not asking more, and they are doing examination most of the case. I think this is only for teaching purpose. And the
Mm.
exam will be different.
Yeah, yeah.
They
And you
usually
have
mention the
yeah,
bedside investigation and examination didn't complete their missing things in the history and examination. They complete by mentioning the bedside as
the
spirometry.
investigation. Yeah,
Yes, spirometry, this patient, blood pressure, urine glucose in certain cases. Yes.
yeah. Dr. Rimaz, you underwent exam before, right?
Yeah, yeah. I had one in 2022.
And you know the feedback. I think you remember, so you can focus on the point you
Exactly.
need
Yes,
to do.
yes. Yeah, yes.
So yeah, you are the most one concerned to this practice and experience with them because maybe UK centers is are different than our overseas centers. I don't know. You went it before, right, in UK?
Yeah. Yes, yes.
So you can understand the examiner mind, what he wants, what he
I
needs you
don't
to
think
do.
they do understand their minds, to be honest. Nobody can understand their minds. You never know what they think about. So,
Okay, at least
um,
you can read the feedback from them, what they
yeah,
need
yeah,
exactly.
yeah, I think it's for me. It was just presenting the clinical signs properly.
Yeah,
Because
yeah. So in the
while
short,
I'm talking, I forget some things, like I forgot clubbing, for example.
um,
Yeah, which was very obvious. That was the most obvious thing in the patient.
yeah. So you will do it in the short cases, and you will start stepwise manner. I mean, you will hold his hand, okay? You will look to the dorsum.
No,
Method
I
is
look at it. I look at
mandatory.
it, but I don't remember
Yeah.
to present it. So I see it, I acknowledge it at that time, but then when I'm
Okay.
presenting, I just feel
Aha.
overwhelmed.
Okay.
So now what
So
I
you didn't.
change is
Yeah.
that I start imagining how I examine the patient. If I'm presenting, I would give you the diagnosis, and then I would start by the positive findings from the hand, the eyes, and everything, so that I don't forget anything.
Yeah. So just try to present the positive first, as they are doing in the past test. They are presenting the positive before mentioning the negative. Why?
Yes,
I
yeah,
guess because yeah, you will not
yeah.
miss it. But
You
if
will
you
not
start
forget
by
it. Yes,
saying, yeah, no signs of
everything.
or blah blah blah, so you will forget what the
Yes,
positive things.
yes.
Yeah, I agree
I
with
agree.
this.
Mm.
Okay. So any question or any comment from others before moving to the next scenario, Dr. Awatif is there?
Uh, Dr. Rimaz, mashallah, she's very excellent, but
Yeah.
she will be more impressive if she, after she's seeing the rash, go towards the GIT analysis and the diarrhea. When she jumped from the diarrhea without analysis, I am asking myself, please return to the diarrhea. But just, yeah, just yes, she will be more impressive for the seminar. Otherwise, she's mashallah.
Yes.
Thank you.
Yeah. Thank you, Dr. Samson. Any other comments? So let's repeat the differential for this patient: osteomalacia, osteoporosis, and inflammatory joint pain. Whatever the reason, we can put it like that. Okay. Dr. Awatif, are you there?
For the diarrhea, also we can put cancers, inflammatory disease like lymphoma, tuberculosis. Yeah,
So, yeah, the examiner might ask the differential of the back pain.
diarrhea.
Yes, and he might ask yes for the area for young patients. So if
Did she
he
mention
will help
serology? I didn't
HIV,
hear
you mean?
serology. La serology for celiac. Did she
Hepatitis?
mention it?
Ah,
Serology
yes,
for
Oh
and
no, I
celiac.
antibodies,
didn't.
antibodies.
No,
Yeah, yeah, she didn't.
anti-BCG.
Yeah,
Yeah, yeah, yeah. I
yeah,
just said
yeah.
antibodies.
Yeah.
Yes,
Uh,
yes.
yeah. Okay.
Just to remind yourself, anti-transglutaminase, IgA antibodies, okay, and
Mm,
endomethelium antibody.
yeah. Anti-endometrial.
And yeah, and don't forget the villus atrophy because you said it might not showing anything, but there is villus atrophy.
Oh no, I thought you asked me about the endoscopy.
Yes, so it will be there also.
So,
It's
on the
upper
endoscopy
endoscopy in the
itself,
duodenum.
it should not show anything. The biopsy show the villus atrophy, right?
Okay, yeah, yeah.
Yeah.
Biopsy. You'll take this a biopsy from the duodenum. Dr. Awatif, I guess it's she's brucellosis. Mm, let's think about the common brucellosis. Yes, if there is farmer dairy milk, but it will be like infection more. Well done, Dr. Imaz. Yes, Dr. Roda. Lymphocyte infiltrate. Yeah, it will be also there. And one of the complication is lymphoma. Don't forget, Dr. Rimaz. Try
Yes.
to read this topic from any source just to
Yeah.
remind yourself. It might come and you will get the full mark, inshallah.
Inshallah. Inshallah.
Okay.
Okay.
If you don't know Dr. Rawat, if someone has the case, you can give to Dr. Rimaz to help her for the exam. Dr. Roda.
Yeah, yeah. Do you want me to give Dr. Rima's case?
Oh my God, yes. So kind of
Okay,
you. Yeah, so kind of you, Dr. Roda. So you will give her a communication and you'll give her a long?
as you wish. Yes,
Yeah,
yeah.
let's give her another case for long because the exam after a couple of days.
Okay, I will write it in the chat. Okay.
Thank you so much. Thank you, Dr. Roda.
Well,
For other colleagues, please don't hesitate to ask or to share or to comment. Don't be shy. I remember when I start to practice in this group, I start like this also, listener, listener, listener. Then I start to share, and after that, I practice. So it's like that. Don't be shy. It's a group for all. As I wrote in the group description, it's for all, even beginner. We started like this. We are not professional from the start. We started like beginner, then we learn. But the difference is we paid a lot of money to learn. Now you are free and you can learn without paying, and we can guide you what to do because there is a lot of business work in our group. So whatever you want to ask, even for the courses for whatever, you can ask. Don't be shy. Okay, Dr. Roda wrote the scenario. Mr. Jamil, 55 years, losing weight for 2 months. We'll give you 2 minutes, Dr. Rimaz, then we'll start.
Okay.
Yes, Dr. Hanan, we are already doing that. We will give her too long, and Dr. Roda will give her another communication. Okay, and I can prepare another communication for her as well. She will not be surrogate today. Today and tomorrow, by the way. Inshallah, will help her to pass. All of us. Yeah, nice question. Advice for beginners regarding courses. Don't take any course. Study, just try to listen to us, and by after day, you can understand how it's going. The books, yeah, there are a lot of books you can, whatever you are comfortable with, you can read. But for the courses, I suggest um, you can subscribe and pass test. This is my advice. After all the courses I underwent, pass test is the only helpful. Even for clinical, you can learn for, yeah, for short, for long, for communication, everything in pass test. But it depends also. If you want to go for clinical course, you don't see patient at all, you can go any clinical course. I will not give names, but don't go long clinical consultation as a course because you can hear us, you can hear the free sessions. Most of our colleagues listened to the free lectures without taking course, and some of them took some courses, but it is not necessary to have a course to pass. This concept must be changed because there is a lot of business work for teaching. I don't agree for that. So try to attend with us. It's a free daily till you have the idea how it goes, and you can collect some cases, you can write, you can listen to the video and the record, whatever. But the course is paying. I see it's haram. Wallahi, and too much they are asking for money and too much they are taking. While you can hear free lectures or you can hear our practice. And again, it's up to you. I can't force anyone to do. But I'm trying to give my experience. Yeah, thanks, Dr. Hanadi. You can hear us here every day. We are available. Don't be shy. You can ask, you can share, you can even comment. By the talk, you will be more confident, not only commenting. It's okay. You are welcome to comment. Okay, sorry, Dr. Rimaz. Yeah, thank you, Dr. Hanadi. Let's start by Dr. Rimaz and Dr. Roda.
Okay.
I will share, I will share the timer. Okay. Here you go.
Hello.
Yes. Hello.
Hello. Hi. Good evening. This is Dr. Turkawi. I'm one of the doctors in the clinic today. Am I speaking to Mr. Jamil?
Yes, doctor.
And you're 55 years old.
Yeah.
So Mr. Jamil, what seems to be the problem?
Yeah, doctor. I'm starting to lose weight, doctor. And this is for the last couple of months. And I lost about 3 stones, doctor. And this is not intended, really.
Mm. Okay. So you've lost weight 3 stones over the last 2 months.
Yeah, doctor.
Any weight loss before that?
No, doctor. I was fine.
Mm. Okay. And it wasn't intentional, as you said. So your diet was okay. You feel like eating, or how is your appetite?
It's poor. It turned to be poor.
You don't feel like eating.
Yeah.
And okay. And um, any lumps or bumps anywhere in your body?
As long as I notice, doctor, no.
Mm.
Yeah.
Okay. Um, any joint pain?
No, not really.
Any fever?
Actually, doctor, for the joint pain, sometimes I feel pain at my ankle and wrist.
Mm.
Yeah, but it doesn't bother me really.
Mm. I would be writing some notes, but it's gonna be completely confidential. I hope that's okay.
Sure, sure.
Okay, so ankle and wrist pain.
Mm,
Any other joint pain?
no, not really.
And any night sweating?
No, doctor.
Any skin rash?
Skin rash, no. And you ask me from the fever, no, doctor.
No fever, no. Okay, all right. And any no skin rash, but any skin pigmentation, dark or light
No,
pigmentation?
no, not really.
No. And any weather preference?
No.
No. And when you mentioned the ankle and the wrist pain, can you tell
Mm.
me more about it? Is it like describe the pain for me, please?
It's something that increase with movement, doctor.
Mm.
I feel like pain, dull aching pain. I don't know
Mm.
what's the problem, really.
Okay. And when you rest, does the pain go away?
It doesn't go away, but at least it improves.
Any swelling with the pain?
I'm not sure. It's like a mild swelling.
Any hotness in the joints?
No,
Numbness in your fingers or toes?
no,
Any change in the color of your fingers or toes with cold weather?
no.
No. Okay. And let's go back to your weight loss. So, did you notice any breathlessness with it?
Actually, yes, doctor.
Mm.
Actually, yes, doctor. I have breathlessness, and this is for a
Mm.
long time, really.
For 2 months or before that?
Before 2 months, doctor, I have this for maybe like 7 years.
7 years. And do you have any diagnosis with it?
Yeah, they told me that I have a chronic obstructive pulmonary disease, doctor.
Mm.
Yeah,
Okay. And do you take inhalers for that?
yeah, exactly, doctor. I take around like 3 types of inhalers, and they were working, but I don't know what happened.
So your breathlessness is you mean it's getting worse now?
Exactly.
Okay. And how long has it been getting worse?
2 months, the same period of my losing weight.
Okay. All right. Any chest pain?
No, not really.
Any cough?
Yeah, doctor, I have cough, and this is for a long time, doctor.
Is it getting worse recently as well, or
Yeah, yeah, I think so.
okay? And what about your have you ever been told recently that you look pale?
Yeah, yeah, my wife told me this.
Okay. And what about yellowish discoloration? Any yellow discoloration in your eyes?
No,
No. Any tummy pain?
not at all.
Any feeling sick or being sick?
No, doctor,
Okay. Any loose motions?
not really.
Mm, okay. And any change in your bowel work? other than loose motion,
I think I'm
constipation?
turning to be my motion turned to be like harder.
Hard.
Yeah,
Mm,
yeah.
okay. Any specific reason for that, you think?
No, doctor. I haven't changed my diet. I'm
Mm.
doing exercise as much as I can. I
Mm,
don't know why. I drink
okay.
water. Yes.
Mm. Any bone pain? You said the ankle and the wrist, but what about other back pain or rib pain or
No,
no bone pain?
no,
Any headaches?
not at all.
No headaches. Any weakness in any part of your body?
Not really.
And what about weather tolerance? Do you feel that you prefer
No. I'm good at anytime. I'm good. I'm fine.
water work are okay, changing
Mm,
color,
no, not really.
or frequency?
I think it's the same, doctor.
Okay. And what about medications? So you said you take your inhalers. Do you take
Yeah.
anything else?
No, doctor. Apart from the inhalers, I take nothing.
And you compliant to your inhalers?
Yeah, very compliant.
Okay. What about any other medical conditions other than the COPD, the chronic obstructive pulmonary disease? Do you have any other medical?
I have chronic obstructive pulmonary disease for the last 7 years, and I
Mm,
have high blood pressure for the last 10 years, and I'm taking amlodipine for it, 10 milligram.
okay.
Yeah.
What about your
Yeah, tell
other
me.
than this, you complain to your inhalers, you said. I'm sorry for asking you again.
Yeah. It's okay. I'm very
Any
compliant.
perfect. Any history of surgery, Mr. Jamil?
Um, no, doctor.
Okay. And what about allergy? Are you allergic to any drugs?
Um, actually, no, doctor.
Okay. What about smoking? Do you smoke?
I was smoking,
Mm,
but I
mm,
stopped it 2 years back. I stopped.
How long have you smoked for?
More than 30 years, actually, doctor.
And how many cigarettes per day?
Like two back.
Mm,
Yeah.
okay. All right. And what about have you worked in any factories, been exposed to any asbestos?
Mm,
Anything?
no, doctor. I'm a teacher.
Okay. And what about alcohol?
I don't drink much alcohol.
And did you notice that you had any contact with someone who had cough for a long time, long-term cough or tuberculosis?
No, as long as I remember.
Have you traveled recently?
Yeah, no, doctor.
Okay, all right. And how you said that you're a teacher. How is this affecting you, Mr. Jamil?
Actually, so much, doctor.
Mm,
Now I'm planning for an early retirement, actually.
mm. Is it because you feel tired or?
Yeah, because I'm feeling tired and breathless,
Mm,
and this cough was increasing.
okay, yeah. Um, I'm really sorry for that. Did you notice any repeated hospital admission last year or this year?
I think yes.
Mm,
And they give me like nebulization in the hospital and so on. Till one GB told me better to go to see a chest physician to help
mm,
you more
mm.
to investigate further. I mean,
Okay. All right. I will start examining you and I might ask you further questions. So I'm just going to have a look at the patients. Is there any oxygen next to him, inhalers, nebulizers?
no,
No. Is he breathless
only
and
his
tachypneic?
inhaler, his inhalers beside him.
Mm. Is he
Yeah,
tachypneic?
yeah, like 26.
Okay. All right. And also, can you give me a cough from the end of the bed, Mr. Jamil?
He give the cough.
Take a
It's
deep breath in.
productive.
Productive. Take a deep breath in and out, please.
Yeah. Uh-huh.
Okay.
Equal, equal chest movement.
Movement. Okay.
Yeah.
Looking at the hands, any clubbing?
Yes, there is clubbing.
There's clubbing.
Yes.
And any leukonychia,
No leukonychia. No
and
koinonia.
fracture. There is nicotine tar.
Yeah, there is no nicotine jar.
Okay. And checking the pulse. Oh, sorry, flap and tremor.
No flapping tremor.
Okay, checking the pulse.
Pulse around 100 regular.
Have you been confused recently at all?
No, doctor. No.
Okay. Any proximal myopathy in the arms? Can you push me up?
Uh-huh.
Proximal myopathy in the shoulders?
No proximal myopathy.
Eyes for pallor and jaundice?
Slightly pale, and his voice is like hoarse.
Did you notice that your voice is changed recently, Mr. Jamil?
Doctor, I don't know why. Actually, my grandson told me this, and I don't know why.
Okay, I'm just gonna ask you to look at the left-hand side. I'm just gonna check. Do you have any tummy pain?
Actually, no.
Checking for the JVB, is it raised?
No.
Okay, now I'm gonna ask you to sit up for me if that's okay. Checking lymph nodes in the mandibular and cervical and supraclavicular.
Yes, there is bilateral lymph node in both anterior cervical regions.
Okay,
Yes.
lymph nodes. Checking chest expansion in the back and doing
Normal.
tabbing.
Chest expansion, like decrease all over COPD patient. Yeah.
Okay, and what about percussion?
Percussion, no, it's like resonant all over,
Okay.
hyper resonant. Yes.
While I'm doing the percussion, I'm looking in the chest. Is there any scars or any?
No scars.
Okay, now I'm listening. Air entry.
Air entry decreased all over.
Any wheezes or fine crepitations?
There is scattered wheezes all over, and not fine crepitation. Like there is coarse crepitation all over.
All over. Can you say 99 every time I put this piece?
Yes.
Percussion note, auscultation.
Um, it's like we can say when he say 99, it increase in the right upper lobe.
Right upper lobe. Okay. And then I will come to the front, checking the trachea for tracheal tug and whether it's central or not.
Tracheal, there is tracheal tug, and it's central, not deviated.
Listening to the heart, locating apex beat and second pulmonary heart sound and right ventricular
Cardiovascular exam normal.
normal. Abdomen, any hepatomegaly?
No hepatomegaly.
Any ascites?
No ascites.
Having, okay. Looking at the legs, any lower limb edema?
No edema.
Okay, so Mr.
So remaining. Yeah.
Mr. Jamil, what's your main concern?
Yeah, why, doctor? I'm getting worse, doctor. By the way, I have a bloody phlegm. This for the last 2 months, doctor. Why
Okay.
my condition is getting worse, doctor? Please.
Okay, and so in this cough that was productive of blood phlegm,
Yeah.
was it on and off or continuous?
Actually, doctor, now like every day, doctor, small amount, doctor. Why I'm developing this?
Okay. Well, this is a very, very valid concern. I'm so glad that you came today, Mr. Jamil. Um,
No.
um, it seems that there are some changes in your lungs on examination from taking a history. When we put things together with the chronic obstructive pulmonary disease, not getting better with the inhalers and the repeated hospital admission with weight loss and all these things, we might be looking at something sinister. That's why we will need to do some blood test and imaging. And we might do some pulmonary function test as well, and the blood gas, the sample that we take from your wrist. I will have a look at these results and then
What
speak.
is going on? What's happening with me? What
Um,
might be happening with me? Please, doctor.
what's your expectation? What do you think might be happening with you, Mr. Jamil?
I don't know. I think worsening of my condition.
It might be the case. However, we will need to rule out any malignancy or any cancer. Looking at your weight loss and the long history of smoking and the long
Yeah.
history of your COPD, we will need to rule out cancer. I'm sorry to tell you that.
It's all right. Okay.
Okay, all right. Um, Okay, do you have any further questions?
No, not really. Thank you, Doctor.
All right, thank you.
Okay, time is up. Let's go to the presentation.
So present your finding on examination.
Okay, so this is a 55 years old Mr. Jamil. On examination, he was tachypnic, lying down, sitting up on 45 degree, with high respiratory rate, a high heart rate. He had his nebulizer and inhalers next to him. He looked pale. Also, I've noticed some hoarseness in his voice, which he mentioned that is new. There was some lymph nodes, positive lymph nodes, along with some wheezes and scattered crackles in the chest. I've also noticed some right upper loop decreased vocal resonance. I believe these conditions, these findings might suggest malignancy. We will need to rule out malignancy, lung cancer in this case.
He has increased vocal resonance, I think.
Oh, increase, sorry, yeah.
And he has clubbing. So what's your differential?
Okay, so the top of my differential would be small lung cancer. Would also need to rule out squamous lung carcinoma. It can also be just worsening of his COPD. Yeah.
What else?
It can be infective exacerbation or tuberculosis, looking at the slightly subacute term of the presentation.
Okay, how you are going to investigate, Mr. Jamil? Yeah.
Okay.
How are you
So
going?
yeah, so acutely, because the patient is distressed, I'm thinking about admitting the patient, doing an arterial blood gas, abdominal X-ray, and full blood count with also pulmonary function test. I need to look at whether if there is any type of respiratory failure, any masses in the X-ray that might suggest the need of high resolution CT scan, any infection markers, high infection markers or anemia in the full blood count, renal function test, or any liver function test, the arrangement to suggest any liver metastasis. I would also need to as I said, do a pulmonary function test, look if there is any worsening of his condition. Then I would want to look for any paraneoplastic findings in the electrolytes, the calcium level, the cortisol level as well.
Why you think this patient turned to be constipated?
I believe it might be a paraneoplastic presentation.
For hypercalcemia, for example, you mean?
Yes, yeah.
Okay, so how you are going to treat? If it is a small cell lung cancer, if it is non-small cell cancer like squamous cell carcinoma.
In the non-small cell lung cancer, surgery and radiotherapy seems to succeed in managing the disease that's not metastatic. However, if it's small lung cancer, it's more likely that there is metastasis at the onset of finding out about the disease. So the management will be more of a palliative pathway.
So why do you think that this patient has wrist and ankle pain?
It can be related to the paraneoplastic as well. Forgot the name of the.
Yes. What's the name?
Forgot the name of the.
Exactly.
Oh, I'm sorry, I forgot the name of the condition.
It's all right. Then what regarding for the clubbing? Give me another differential that could be in this patient apart from the cancer and, like, for example, tuberculosis.
In respiratory system, I would think about interstitial lung disease or cystic fibrosis. If I'm looking at clubbing, also the cancer, as I said, yeah, can be a diagnosis.
Yes, with a productive cough and facial long history of COPD, you can, yes, bronchiectasis.
Mm.
Okay, so what are the type of non-small cell lung cancer that you know?
I know the adenocarcinoma, squamous cell carcinoma, and bronchial cancer.
Okay. Okay, good. Excellent.
Okay.
Thanks, Dr. Rhoda.
Yes.
And thanks, Dr. Rimaz. Yes, let's hear the comment from Dr. Rhoda, then I will comment.
Actually, you did great. You reached the diagnosis. I have one comment in the history. You asked me from the cuff why you forgot the hemoptysis.
Analyze the
Important
cuff.
to ask.
Yes, completely
Yes.
forgot about it. Yeah.
And why you think this patient got a hoarseness of voice?
Involvement, metastasis, probably involvement of the lateral recurrent laryngeal nerve.
For the left recurrent laryngeal nerve, for example,
Yes.
pressed by the tumor or something.
Yes.
Then regarding the differential,
Or
yes,
direct.
yes,
Or direct invasion to the cord. Maybe the lesion central and direct invasion to the
Can be, yes. Yeah,
vocal
metastasis.
cord.
yeah, and most probably this is a non-small cell lung cancer, squamous cell carcinoma. It tend to be central, as Dr. Basim said. It could press this nerve, and if it is a small cell lung cancer, it could be like this patient will present with metastasis. But this
Yes.
most probably squamous cell carcinoma, and he has like this what is called as hypertrophic pulmonary osteoarthropathy. That is
Yes.
why he got an
Yes.
wrist and ankle pain. Yeah,
Yes.
yeah,
Hypertrophic
which is
pulmonary
associated.
osteoarthritis.
Yes, exactly, which is associated also with the squamous cell carcinoma, and he is constipated for the hypercalcemia and also associated with the squamous cell carcinoma. Regarding your differential, yes, we will put cancer, you will put bronchiectasis, TB, last thing, because no patient with COPD has clubbing. When he has clubbing, then think about other things that can cause clubbing. Regarding your investigation, I think good. Regarding the treatment, if it is like early surgery, if it is late chemotherapy, and I think so. I think if it is like early surgery, late, I think chemotherapy. I think, but I'm
Yes.
yes.
Most
And
of the non-small are surgically
operable.
resected. Yeah, can be surgically resected. Yes.
Yes.
Go
Yeah.
ahead.
And you need to say for the rest like pulmonary rehabilitation, vaccination, those things. Don't forget them. Okay. And that's it. You did great.
Yeah. Okay, thanks, Dr. Roda. Nice case with a lot of differential. But I will comment, Dr. Rimaz, and
Yes.
advice. Take this general advice. Whenever you have something positive, analyze it. The previous case you had diarrhea and you didn't analyze. This
Yeah.
is, yeah, I think this is your weakness point. Whatever and whenever you have positive, analyze. Here, the cough, yeah, analyze the cough. What the problem? The cough, not only cough dry or expectoration, there is alarming for the cough itself. If there is expectoration, what is the amount? What is the color? Infection, yellow, green, because it will guide you. Green for Pseudomonas, yellow for some viral, or white, it's just upper respiratory tract infection. The color of the blood or the amount of the blood, pulmonary embolism can be with tinged blood, HIV, and TB, large amount. Bronchiectasis, it will be with blood tinged amount or tinged streak of blood. So don't miss those things. It will guide you. Like this patient, cancer, it's on the top. He has bloody cough or blood in cough. So it's top of differential, along with the loss of weight and history of smoking for a long time. It's a triad for cancer or lung cancer, plus some invasion or direct compression to the hoarseness. Even the hoarseness of voice she gave to you, Doctor, my voice is hoarse. Okay, open your mouth, please, for me. Can I see your mouth? Just as acting. You will not see the vocal cord, of course, but you might see that some fungal infection. You can tell the examiner just to show him that like you are caring for this thing, not
Mm,
just skipping to the next what else? Okay? This is
mm,
the only weakness point for you. Otherwise,
mm,
you are doing great. You are collecting, but sometimes you are not linking the things. In this patient, along with the loss of weight and appetite, loss poor appetite, lumps or bumps by examination. What else? Yeah, the hoarseness of voice, the cough, blood. So it's coming mostly with with the cancer. By the way, you can put HIV here. HIV you can put as differential because he
yeah.
might have infection before, and this is super added infection like BCB pneumonia. Might come with cough and like this, but it will be little bit short of breath while doing exercise. But still, any infection on top of HIV you can put in this case. Why patient loss of weight? Because of HIV, and he got infection that complicated the case, and he's coughing blood because of that. Okay, so let's start from the beginning. You know, loss of weight analyze. You did a great onset course
Mm,
duration, how many over how long, and the appetite was good or no. He told you no, poor appetite. Lumps or bumps, directly go to the constitutional. And I will give you another general advice. Old patient, old patient, go direct to the long-standing disease. After constitutional symptoms, if you have one of the constitutional symptoms in the complaint, do analysis of the others, like loss of weight, appetite, and lumps or bumps, fever, night sweat. Start by
okay.
this. Then yeah, if he's old, 55, 40 and above, he might have long-lasting or long-standing disease. Ask him directly. COPD, okay, why? So he's smoking how many, over how long? You can reach to a complicated smoking case like COPD on top happened cancer from the start. Then you can just do quick system review, like only reviewing them. So let's say for the CNS, you will not find anything unless there is some paraneoplastic, as you catch in this patient, but you didn't analyze it again. The constipation, you didn't tell why, how many per day, and it was related to what. You should put
Mm.
this positive thing means something. He is not putting this symptom for free. He will give it to you
Oh yeah, I've put it
for
in the
some.
positive. So I've put it in the positive things. So the
Mhm.
positive were the ankle and wrist pain, the dull aching,
Yeah,
shortness of
yeah,
breath,
yeah,
COPD for
yeah,
7 years, pale,
yeah.
hypercalcemia, high blood pressure. I put all in voice change. I put them all in one circle, and I just started to
Yes,
looking at
excellent.
them. And yeah,
Yeah,
exactly.
excellent. So the CNA, the cardiovascular, you asked for chest pain, but awareness of heartbeat important. But you rolled out anemia by pale, you looks paler, and the jaundice. Chest, there was of course cough, and you didn't allow the cough. Here the point. GI, feeling pain, sick, feeling sorry, any abdominal pain, any tummy pain, any feeling sick or throwing up, lose motion, and he told you yes, I have hard bowel motion. Same time you thought about hypercalcemia, immediately ask about the other symptoms of hypercalcemia, which are mood change due to hypercalcemia, feeling thirsty, polyuria, like this. Try to get the positive from the positive. Constipation, what do you think constipation in chest patient? Paraneoplastic squamous
Mm.
cell
Yeah.
carcinoma
Yeah.
due to hypercalcemia, bone pain, abdominal pain, passing stones, hypercalcemia stone, I mean, polyuria, polydipsia, mood change, depression due to hypercalcemia.
Mm.
Then the joint, as you mentioned, and you analyze it well, and ankle and wrist. And for me, it's yeah significant, but I will not reach to the term, osteo, even I forget.
The
Hypertrophic
name of the condition, yeah.
pulmonary osteo. So it's HOPA, right? It was
Habboa,
called HOPA, right?
habboa. I get it.
HOPA.
Some people there's a lady and people habboa. The lady is squamous cell
Ah.
carcinoma. Habboa means in Sudan it means they love her.
Okay,
Um,
good knowing.
yeah,
Abuha, yeah.
I think it's something pulmonary osteo. Oh my God, I forget it again.
Osteoarthropathy. Yeah.
Osteopathy.
Osteoarthropathy. Yeah,
Yeah.
osteoarthropathy. Yes, Dr. Tahir, he wrote it. Yes, thank you, Dr. Tahir. Okay, skin rash. No, skin rash. Family history, you didn't ask. Which is very important in this patient. When you remember the travel, you forget that family. When you remember the family, you forget the travel.
Yeah.
I Okay. You remember that mnemonic yesterday I put Fatma, Fatma, Fatma. F for family, T
Mm.
for travel, M for medical, H for HIV, and including the sub question. I mean, other question in HIV. The medical also
Mm.
including the all question of medical, surgical, allergy, medical over
Treatment,
counter,
medication.
herbal. So Fatma, just remember Fatma in the social. Fatma,
Yeah.
FTMH, FTMH. Ask them
Okay.
as a package: family, travel, medical, and HIV. Here you
Okay.
can ask for HIV. Why? He might be HIV patient and on
Yeah.
top opportunistic infection.
Mm.
But why HIV he will get from where? Either from recreational sharing needles or
Mm.
piercing, tattooing.
Mm.
You might be your patient in these things and you might not reach to the diagnosis. Why? Because you didn't ask about. It's not common, but sometimes happen. If tattooing, if piercing, it will be the risky for HIV entrance from this area or casual relationships. So Fatma, please remember Fatma, FTMH, family, travel, medical, and HIV. Then the examination you did it great. Bronchiectasis, pallor, jaundice, and the full examination of the chest. Full exam, lymph node, of course, you did it great. Inspection, palpation, percussion, auscultation. Do it in this way. Don't do step before step. Inspection for any scar and the trachea shifting or no, or and expansion of the chest from at the end of the bed. Then the palpation by palpating the expansion by your hand to 3 levels in the front, 2 levels at the back. Tracheal tug, tracheal deviation. This is by palpation and lymph node as well in the neck, cervical, and occipital. And you can offer axillary and you can offer inguinal, but they don't do inguinal. Percussion, so you'll do front and back. Front over the clavicle, bilateral in comparison, always the levels front 4 levels or 3 levels, and the axilla in comparison as well, and the auscultation for the same 3 areas and in comparison, plus the axilla, and 99. That's it in the front. At the back, the same. Inspection, palpation, percussion, auscultation. Okay. This is for full examination of this patient. You should do chest examination full. You find in this patient right apical lesion. So you have bronchial breathing, you have increased vocal resonance, you have also 99. Yes, it's vocal resonance, the same. That's it.
Okay.
A lymph
Yeah.
node, we did it. Yeah. Okay. Our differential, as you said, cancer. So lung cancer, don't say malignancy by any way to the patient or
Mm.
even the examiner. Lung cancer is okay for you or for the patient or for the examiner. Lung cancer, it's no need to say malignancy. Lung cancer. Okay. The second, so you can mention all types of, but specifically you can mention squamous cell carcinoma. Why? Because I had signs of hypercalcemia from the hard stool, from the mood change, from polyuria, polydipsia, or bone pain, whatever. Then, if not, you can say the small cell. Small cell, what the paraneoplastic and small cell, Dr. Dimas? Try it today. I'm trying just to squeeze you in that information because you might have
Yeah.
this case
I
after
think is
tomorrow.
it the Sayada?
Yes, excellent. What else?
Mm.
It's small. I remember this in part two. While it's small, but it secrete a lot of
ACTH?
hormones. Yes,
ACTH?
Sayada. Sayada and yes, steroid.
Yeah.
STH for steroid.
Mm.
Yeah, both of them. And I think Lambert Eaton as well, if I'm not
Mm.
mistaken. Yeah, it was small, but it's secreting large substances like Sayada and steroid ACTH, and if I'm not mistaken, Lambert-Eaton syndrome association. And on the other hand, non-small cell, as you mentioned, squamous in the smoker patient. In non-smoker patient, adenocarcinoma, bronchogenic carcinoma, and neuroendocrine, which is carcinoid. Okay, this is the
Okay.
non-small.
Yeah.
Non-small. Small, one category or an arm, an arm. Then the other arm is non-small. In smokers, squamous cell carcinoma. In non-smoker, adenocarcinoma and bronchogenic carcinoma. Then neuroendocrine. This is not related to smoker, but I am just mentioning other types. Neuroendocrine for carcinoid. S always for centrals. S for central, small cell cancer and squamous central. S for central, central lesion, I mean. And adenocarcinoma, not S, so it will be at the periphery. C, carcinoid is still S, so it's also central. And bronchogenic means in the bronchus, so it's maybe central, maybe also peripheral. But remember, S for central, S for central, or C, central. So squamous cell, small cell, all of them are central. But the adeno, peripheral, and the carcinoid C also in the central, so S or C. And the bronchogenic means in the bronchi, so either central or peripheral, according to the area of overgrowth. Yeah, this is the first
Yeah.
differential. Second differential, TB. But you did great in asking any history of contact with sick patient called TB or tuberculosis. You rule it out, but still you can put it because he might have the infection from someone else. He doesn't know it, or he doesn't know his history. So TB and the last HIV plus bronchitis on top of his COPD. Okay. The good thing also you ask for the smoking, the alcohol, the job, the previous job. Very important, this patient. You ask target question, asbestos. Are you exposed or did you or have you ever exposed to what substance called asbestos? Or you can ask him in general, what's your current job? I am teacher or I am retired. Don't just be quiet after retired. He might be exposed for long term to substance called asbestos. He will just tell you, yeah, I was working in a factory and they are using what's called,
Mm.
or I was in a shipyard. So it's clean for asbestos, and also this is a risk for cancer. Okay, it makes this asbestos plus smoking make the cancer, I think, 50 times. Okay, the driving, it's okay here, that not related to the case. So this is our case, two cases long today. Tomorrow we'll give you another different. I will try to bring another common and high yield topic in the exam. Be ready and
Inshallah.
yeah, keep it up. Any question or comment for this case or the previous one? And before moving to the communication, I will give you a case and Dr. Roda as well. But I will ask you a question. What case you didn't practice and you wanna do it?
In communication,
Yeah, any specific topic?
functional. Oh my God. I keep just
Okay,
thinking about it, but I've never done it. The functional
let's
disorders.
let's do it. Let's do it.
Okay. Okay.
Yeah,
Guys,
because
so in
good day.
communication, I know my weakness point. I speak fast and I don't know, somehow I'm not showing enough sympathy. So if you can help me to
Yeah,
be more just yeah.
just
Okay.
acting. Do like you
The
are in an
problem is,
interview.
Dr. Basim, I teach people these things. I teach OET, so
Oh my
I
God.
on how to be
Oh,
how to be sympathized. And I used to be very empathetic person, but I don't know what happened.
just remember to slow down your talk while
Yeah,
talking to the surrogate.
yeah,
Remember when you start, of course, after good sleep, you will never have good focus while you sleep less before the
yeah,
exam.
yeah,
You'll be stressed, your mind will not be with you, and you just do whatever you are doing as an stress. Trying to fast finish the case and try to give the message quickly. So no, just calm down. Remember your practice days with us. Remember the advices. Remember the weakness point of analyzing the complaint more and more. You will be more professional in the exam. So
Inshallah.
Dr. Roda, yeah, Dr. Roda, inshallah, you will do it. Uh, what other case, Dr. Rimaz, apart from functional?
I think, see, the cases where I need to tell the patient about the disease. So, for
Yeah,
example,
okay.
MS is okay. I
MS.
think I went through MS, but just
MS you did? Okay.
explain to patients, because apologize and medical errors. I've done this a lot. It's just
Yeah.
talking about disease, and
Mhm.
yeah, I think these are the things that I might.
Okay. So I will give you a disease.
Okay.
And Dr. Roda, if you have the functional the functional scenario, Dr. Roda, you have it if she is there. Okay, I hope she didn't leave. Okay, you have the scenario, Dr. Rimaz,
No,
I mean the
I've never
functional.
heard anyone. I think I heard people doing it once, but I don't have a scenario, to be honest. No.
Okay, so one of them is I hear the functional MS. This is the last one.
Okay.
There is what's called functional MS. You want to do?
Mm. Yeah, we can do it. Yeah.
Or yeah. So I will just create the scenario,
Okay.
then be ready after 2 minutes. And the other scenario will be for a disease counseling. I
Okay.
will give another disease. So I will try to do the case together with you if no one there. So we have Mrs. Lisa, 35 years.
Assalamu alaikum. Dr.
Alaikum
Rimas, I
assalam.
can give you example only for this functional. I hear it before. This
Okay.
patient has abdominal pain, young, and she's going seeking medical advice from different doctor, but
This
in your consultant, yes, diagnosed as IBS.
irritable.
Yeah.
Yeah, irritable bowel.
The second one, patient, the father, son, 16 or I don't know, you sit with his mother. She insisted to do for him coronary angio because his father died from, he has ectopic because of caffeine, normal ectopic, and the consultant said that it's normal. But the mother
Mm.
insisted that he should do for him coronary angio or something like that. Other one, patient nurse, she's working in the busy ward of stroke, and she have stress and problem in her work, and she made herself that function, and she had conversion hemiplegia. She said she had stroke, and when you ask her expectation for CT result, she will say for you, yes, doctor, I have this stroke, you know that because she's nurse like that. But
Mm.
unfortunately, everything normal. I think these three examples of functional.
Okay.
Yeah. Okay. Dr. Hind also gave us scenario
Mm.
for, I think this is irritable bowel or tension headache. Yeah, I think this is tension or irritable bowel along with tension headache. Or I don't know about the MS functional if you want to do as a new case because we just will do as MS and normal finding. If you want to do, just choose Dr. Romance.
No,
You got
anything. No, anything really.
so it's the same idea.
Mm.
Okay, let's talk about this scenario in the chat box. So you have Mrs. Kathleen, 35 years, complain recurrent symptoms of long time like headache, abdominal pain, fatigue, all investigation including CT brain were normal. Kind of sit with her, reassure her, and tell her no need for further investigation. I'll give you 2 minutes, then we'll start. Be sure this scenario, if you apply for any scenario, the same way.
Okay. So she.
Catherine, 35 years. I will share it to the page to be more clear for others. Mm,
Thank you so much, guys. I appreciate this a lot, wallahi. Jazakumullah khair.
mm. You're most welcome. Inshallah, you will do it. Inshallah. Hopefully.
Is it in the group or the chat box?
Chat box. I'm trying to
Oh,
put it on the
okay.
dashboard. In the dashboard.
And this no need for further investigation is the consultant decision, right?
Yes, this is
Okay.
your task actually.
Okay. All right. Okay, we can start.
Yeah, you can. You can see the
Yes,
timer?
I can see it now.
Yeah,
Yes. Hello?
let's start. Here you go.
Hello? Okay.
Hello,
Hi. Hi, good evening.
good evening.
Hi, this is Dr. Turkawi, and I'm one of the doctors in the clinic today. Am I speaking to Mrs. Kathleen?
Yeah, yeah,
And you're 35 years old.
yeah, doctor.
Okay, so hi, Mrs. Kathleen. Um, may I ask you what's your idea about today's meeting?
Yeah, doctor, I'm here because I'm sick, doctor. You don't believe that?
No, why do you think I might not believe? Is there any specific reason that you might think I might not believe that
Yeah,
you?
doctor. I sit with a lot of doctors. I'm telling them about my complaint, and they are
Mm,
repeating the same scans,
mm,
same workup, and they keep saying I don't have anything. What is
mm.
that, doctor?
Okay. Sorry, it seems like you have been through a lot. So what are you expecting from today's meeting, Mrs. Kathleen?
You will do whatever I want, doctor. I want to do MRI.
Okay.
Yeah,
Uh,
this
and
is my
and
expectation.
and is there any reason that you specifically wants the MRI?
Yeah, doctor, I have this headache for a long time, and
Mm,
you're just saying that I don't have anything. But
mm,
I read in the internet that MRI is the magic of diagnosis. That's why I'm here. Just give me this request and I will do it.
okay. All right. I can see where you're coming from, Mrs. Kathleen. Um, uh, as you said, we're here today to talk about your results. You had a lot of blood tests and scans.
Okay.
Yeah, yeah, you had a lot of blood tests and scans because of the symptoms that you've had, and you've been struggling for so long time with your headache. You had a CT scan to the brain that, and the CT scan is normal, which is a good news.
Okay.
Are you following me?
Yes, doctor. What's new,
Yes.
doctor? You
So,
told me before that the CT is okay and nothing is there.
mm, yes. So I'm here today. We're having this meeting because I need to reassure you and to tell you that all the blood tests and the investigations that we've been doing over the last period of time is normal, which means that um, there is no need for further investigations, basically.
Again, doctor, you are repeating the same issue with my consultant before. How
Mm,
can I convince you guys? I have headache, I have tummy pain, I'm
mm,
suffering a lot. And you're just saying nothing, nothing, nothing. What
mm.
is that?
Okay, I'm sorry for it seems that you've been struggling, Mrs. Kathleen.
Yes,
Um,
doctor.
yeah, and I'm
Believe
sorry
me,
about this.
doctor.
However, um, you don't have to convince me really with anything. I completely believe you, and it's my duty to believe the patients.
Thank you, doctor.
Um, that's the first reason we're doing all these investigations for is because we know that you have these symptoms and you've been struggling, and that's why we've been looking for reasons. However, after all these blood tests, as I said, we couldn't find any reason, which is a good thing. I just need to ask you some questions. Maybe it might help guide us to the right direction. Um, would that be okay?
Oh, yeah, doctor. Okay.
Um,
If you will
okay,
give me the MRI, I will answer every question you ask.
okay.
Here you are, doctor.
We
Yes.
can talk about the MRI later. The MRI is
Okay.
not an option in until now. So have you been going through any mood changes recently?
Uh, yeah, actually, doctor, yeah, my job is little bit stressful one. I
Mm,
am getting more promoted now. Yeah.
mm. Oh, congratulations on the promotion. And what do you
Mhm.
do, Mrs. Catherine?
Yeah, I'm the manager now, and I am responsible for a lot of stuff
Mm,
in the
mm.
bank.
And that it must be stressful.
Yeah, doctor, too much.
Yeah. Okay. All right. And any feeling low recently?
No, doctor. No, it's just some more responsibilities only. I don't feel low,
Mm,
doctor. My
okay.
mood's okay, but some stress in the life, doctor. It's going like
Mm.
that.
Yeah, yeah. Yeah, I'm sorry about this. And any difficulties at home at all?
Uh, some difficulty. What do you mean, doctor? What kind
Any
of difficulty?
difficulties at home? I mean, are you well supported? Do you feel do you live with someone?
Yeah, doctor, I live with my partner,
Do you have to
and
look after anyone?
yeah, doctor, he is not working and he is jobless. I'm
Mm,
the one taking care of him.
mm.
This is also another responsibility.
Yeah, yeah, I can see. It must be frustrating, really. Okay. And it seems that you're going through a lot, Mrs. Kathleen, to be honest. Um, and did you try to seek any help with this? As you said, you're a little bit anxious about your job and overwhelmed with the promotion, and whatever is what's happening at home with you as well. Did you try to speak to your GP or anyone about this?
No, doctor, actually, honestly, no.
Mm,
I just sit with you now to
mm,
address the request I want.
yes. Okay. So having all these symptoms, Mrs. Caslin, would make sense. What I say when I say that there is no physical explanation of these symptoms, that doesn't mean that it doesn't exist. It just means that there is no disease causing them. However, you're obviously going through a lot. And you had a lot of an anxiety and a lot of stress in your life. And when our brain is stressed, sometimes it can manifest the stress can manifest in symptoms that we would feel. Are you
Hmm.
following me?
Yeah, yeah.
So what we need to do is we need to maybe try to refer you to someone to help you talk to. They have a really good programs, talking therapies that might help you get rid of your anxiety.
What do you mean, doctor? Do you think I'm mad? Want me to sit with someone? And do you think
No,
I'm mad, doctor?
no, completely not. And it actually on the opposite.
Hmm.
You're a very successful
Yeah.
person and you're leading a very successful career. And I think this is a huge responsibility and it's a lot of pressure
Hmm.
on your psychological health. And I think
So how
because
can
you're
he help
anxious,
me, doctor?
yeah, as I said, we can refer you to the
Hmm.
talking therapist. They can help you with a lot of things. Talking to them might help. They might give you activities to do to get rid of the stress. They might give you some tablets if needed, some medications if need be. But it would be very helpful if you would be happy for me to refer you to them.
Doctor, yeah,
Mm.
does make sense for me.
It does, right?
Makes sense for me, yeah.
Yeah, that's great. Yeah, I'm so glad that we are on the same page. Um,
Uh,
Um, Let me ask you for the questions. What about
mhm.
smoking, Mrs. Catherine? Do you smoke?
No, doctor, I am not.
And what about alcohol?
Yeah, yeah, I'm drinking alcohol.
Mm,
Sometimes the alcohol also release my stress.
mm. So how often do you drink alcohol if you said on an average
Maybe
week?
10 to 12 unit, doctor.
Okay, yeah. 10 to 12 is within the limited, reasonable, non-harming amount of alcohol. I highly advise that you don't exceed the 14 units because it might lead to reverse consequences. So we are on the same page now, Mrs. Kathleen. You're happy for me to refer you to the psychology
Uh-huh.
team. Um,
Okay.
that's great. Do you need any help with your job? Do you think you might need some sick note or occupational health referral?
Actually, doctor, after this promotion, I didn't take any vacation.
Mm,
Do you think, doctor, if I have vacation, it might help with me?
I think it definitely would help, but you would need to obviously you need to separate yourself from work when you're on vacation, not to think about work and not to be stressed about it. I think vacation would help very much. Um, yes. And do you have any further questions or concerns, Mrs. Kathleen?
Uh, so far, no, doctor. When you will give me the appointment with this doctor or this talking team?
That's a very good question. So I would refer you today. You should wait to hear from them. They should contact you in the next couple of weeks, and they will give you an appointment. Would that be okay?
Okay, doctor. Thank you.
All right. Thank you so much, Miss Kathleen, and thank you for seeing me today. And we have 10
Thank
seconds left. Awkward silence.
ah, leaflet, yeah, leaflet brochures,
There are some
relatable bars in the
leaflets that
room.
I might give you to help you with the anxiety and stress and dealing with these things in life.
Thank you, doctor, for your precious time.
Okay.
Okay, great, great, perfect. You
Okay.
did it. Yeah, it's a stressed one, but you did it. Just come here down and everything will be okay. So let's start from the beginning, the comments. Any question from your side first? Any question, Dr. Maz? Hello?
Any question
Okay.
from me or for
Yeah,
me?
from your, yeah, from you. Any question for
Um,
me, from you? Okay, let's hear the comment, then you will
yeah,
give me
yeah,
the question.
maybe I
Okay,
will. Yeah.
I guess you didn't give me the introduction. You asked me about my name, but you offer your name. I guess no. Maybe you didn't say your name.
Oh, no,
You
no, I
just
did.
you did?
Because I forget to mention my name, I've written it down this time.
Okay. So it's like skeleton to follow and scheme to follow it. Introduction, invitation, but this case better not to invite someone else because maybe confidential for here. The acknowledgement about the condition and the expectation, you did all this. And exactly, I give you the expectation from the beginning. I need to do MRI. But at the end, you address my concern and you convince me successfully. So you start to explain to me what's happening. Just one word I want to add to you, the body overreacting to some stress in your life and manifest with these symptoms you have. As you mentioned, but just mention the word overreacting, okay? Because it's normal, the body will react, but your body is overreacting. And that's why I have these symptoms, which are headache and sometimes pain, which is called irritable bowel syndrome. So you immediately address what I have in stresses in my life, starting from the financial, the job, and the home, and you can add also the week, sorry, the sleep time. I'm sleeping well or no, and yeah, home support. For the work one, you address that, and you just give me an option to sit with the talkative or talk doctor or team, just to have a talk with them, and they might have a program to help me in this regard. Yeah, it was a great idea, and it might reach to some medicine as well, as you mentioned. Yeah, sometimes they are giving antidepressant, but not as depression patient, no, as a mood stabilizer, just to help to relax or to calm me down. Then the stress at home, yeah, you address it. But if you can offer some social support to the home issue, for example, my partner or whatever the reason, you can just tell I will involve our social team.
Yeah,
Uh,
they get scared from the social team. So you don't involve the social team unless it's you will they will be
in
scared. They
need.
will panic if you mention the social team. Yeah.
Yeah,
So
okay.
yeah, unless her husband is hitting her or something. Uh,
Okay. But
yeah.
for his job, okay, for example, he's jobless. What you can do? You
But
can do offer
if I'm
something.
a doctor, her husband is not my patient. I can't help him. I can only help
Uh-huh.
her because she's my patient. So even if
Yes,
her
okay.
husband is
So,
fell
yeah.
down and broke his neck,
Yeah.
I can't do anything about it.
Not to that extent.
I really can't do anything about it.
Yeah, I know,
Uh,
but okay,
unless he's
just
my patient.
yeah, at least appreciate her concept. Okay,
Yeah.
then the explanation and anxiety, and you told me about the anxiety and the overwhelmed in the work and the job and the home. That's why I have these issues. You arrange a meeting, but you told me when while arranging the meeting, I will arrange today, and they will sit with you, the couple coming
No, I said I
weeks.
would refer you today, and
Yes.
they will get back to you. Yeah, to give you the
Okay.
appointment.
So yeah, try to mention as soon as possible, whatever. It's maybe
Mm.
today it's
Yeah.
not perfect for the consultant. as soon as possible. It's I mean it's a board and a wide word, but it's not away and it's not near. It's just as soon as possible. When it will be, we will update you in the appointment or the coming appointment, or we'll send you a message or whatever. Okay. So
Mm.
just try to say, yeah, don't give a time frame. Just say as soon as possible, in the coming weeks, in the coming days, in the coming hours, as we have a rule for that. Then, yeah, the closure is very important. Just offer me if you have some times, or if you don't have the time, at the end of any meeting, offer me the leaflet brochure website groups about my condition. That's it.
Okay.
And thank her. Goodbye.
Okay.
Okay. You did great, by the way, and just to remind you the steps, and you can follow it.
Mm.
Now we will do the second scenario about counseling the disease. Dr. Roda, did you join us? You can do, or you want, or I can do the other case. It's okay
Okay, as you wish.
because so you have a case,
I,
or
I have I have a procedure case.
no, no. She asked for counseling about disease, and
What's
I
the
was
case that you
preparing
have?
I have a procedure.
procedure.
Oh,
You want to do procedure, or let's do, for example, today, the counsel or the procedure, and tomorrow I will give you
Yeah.
the other one, the counseling about disease.
yes, yeah, we can do that.
Okay, so Dr. Roda, give her the case.
Okay, hold on.
Yes, there is a comment. Excellent. So it's easy, Dr. Bimads. Just
ده هو
relax, calm
الكلام ده
down.
الكلام ده لعبتي انا حاجة فيها العلم والطب
Yeah,
هو مشكلتي
yeah,
الكلام ده
yeah.
عادي يعني.
But in this way, you did your sympathy and empathy. You did it in the previous case.
I think being conscious about it, like remembering that I need to do it is
Mm.
helping.
Yes, reminding
Mm.
yourself, always
Mm.
remind yourself that
Yes.
I
Mm.
should analyze the complaint. I should examine the main complaint first. Always write your weakness point in a paper before the exam, read it before going to the exam. You will not study, just the
Mm.
weakness point to one of them, the FATMA, FTMH, family travel,
Mm.
medical, and HIV. The second thing, the analysis of complaint. What is the complaint analysis? Well, and whatever in the scenario ongoing discovered, analyze it. Don't skip it. It might be helpful for your diagnosis, and it might be diagnostic, like loose motion in my case today, celiac, and
Yes.
Dr. Roda case was cough with blood for cancer.
Yes.
Okay, Dr. Roda wrote the scenario for you.
Did she? Okay, let me check.
Yeah, read it. Check and read it loudly.
Okay.
John,
You
from
are a
Mr.
junior doctor.
John.
You are a junior doctor working in cardiology ward. Mr. Hugh Jones, age 23 years old, has congenital heart disease. He was admitted from clinic for further investigations into the cause of his breathlessness. The view of the cardiac team is that it will not be possible to give the best advice about prognosis and treatment without information from a cardiac catheterization study. Sit with him, explain the management plan, and address his concerns. Uncertainty. طيب. Okay, 2 minutes only.
Yeah, sure. We'll start in, or we'll start 12:50, so 3 minutes.
Okay.
Okay, ready?
Yes. Okay. Hello.
Yes, hello.
Hi. Good evening. My name is Dr. Turkawi, and I'm one of the doctors in the ward today. Am I speaking to Mr. Jones?
Yes, I am.
And how do you like me to call you?
Um, call me, yeah, call me Jones, as you
Okay. All
want.
right, Jones. And you're 23 years old.
Yeah,
Okay. How are you feeling today?
I'm great.
That's good. What are your idea about our meeting today?
Yeah, doctor. I'm here because they told as going for my outpatient clinic appointment, and I want to know what is going to be the further steps in my management.
Mm,
Yeah.
okay. Okay, that's a very good question. So, I understand that you've been struggling with your breathing recently, and for this, to find the diagnosis for your condition, as you want us to, we need to do further investigations, just to try to find out to reach an actual diagnosis and know what's going on.
Actually, actually, they told me that I have a congenital heart disease.
Yes.
But
Yes.
they told me that they are gonna doing further investigation. So I'm keen to know what are they.
Okay.
Yeah.
That's a very valid concern. So the investigation, the test that we need to do to you, it's a procedure where we use a wire through one of the blood channels, the vessels in your leg, and try to reach your heart through these vessels, the blood channels, and measure the pressure and have an idea about how is your heart built, and if
Mhm,
there is any abnormalities, any abnormal or any abnormal findings,
mhm. Okay.
enable for us to find out a way to put a good plan,
Mhm.
and to give you a good idea about the outlook of your condition. Does that make sense?
Okay. Okay.
Mhm.
Is this kind of procedure painful?
Um, that's a very good question. Um, there might be some discomfort with it. We would try. It's usually there is no big wound. We try
Mhm.
to numb the area before we go in.
Okay.
And as I said, it's a very small wire. So
Mhm.
there might be some minor pain and might be some discomfort. However, there are other uh, complications that might happen, like in any procedure. Do you want to
Mhm.
hear about them?
Please.
Yes. So every procedure comes with complications, as I said. One of these complications might be introducing an infection, a bug. However, to avoid this, we try to make sure that we go sterile and that the field needs to be completely clean in a very clean and sterile operating room.
Mhm.
There might also be some bleeding,
Mhm.
um, which is we try to avoid this by stopping your blood thinners if you're taking any,
Mhm.
um, and trying to minimize the cut in your skin. Also, there might be some injury to the surrounding structures. So, surrounding your blood vessels, the blood channels, there might be some nerves and
Oh,
other organs.
oh,
So,
doctor.
injury to these, yeah, sorry.
Oh, doctor. Is this procedure may cause death?
Um, that's a very good question. It's unlikely to cause death. However, death is always
Oh.
one of the complications of every procedure that happens in the hospital.
Mm. Doctor, is there any alternative? I'm really afraid because of this procedure. Any alternative, please?
Yeah, I'm so sorry. I can see that you are worried about the procedure. However, I believe this would be the only way that we can find out uh, about the how is your heart functioning, and how is the prognosis, sorry, the outlook is going to be, and it will be very helpful for us to give you an accurate plan.
Okay, doctor.
Okay.
Yeah. Okay.
And do you have any questions? Any other questions, Mr. Jones?
Doctor, during the procedure, should I be like awake, doctor?
Do you? I'm sorry. Again?
Is it like will be awake or I will be like sleeping? What's going on? What
Usually you would.
exactly?
Usually you would be awake. Yes. Um.
If I
It's you
want,
don't need to be asleep for this procedure. I'm sorry, I can't hear you. Can you come again?
I really I am afraid of procedures.
Mm.
Can you just give me something to like sedate me, please?
That's a valid question. I think we will need to go through this with the anesthesiologist if they're happy with that. Um, but we need to check with them first, and I might need to check with my senior colleagues about this.
Oh, okay, doctor.
Okay.
Okay, doctor.
Do you have any further questions?
Actually, no, doctor.
No, okay. Um, I can see that you are worried about this procedure, Mr. Jones. However, I can always give you a lot of leaflets to explain the procedure, the detailed procedure itself, what we're gonna do, cleaning the skin, making a small cut, going in with the wire, what you should expect before and after the procedure. You don't need to be admitted to the hospital. We're just gonna ask you to avoid any uh, um, aggressive kind of activities using that leg.
Yeah.
And
Okay.
okay, but the leaflet should have every all the informations. And you obviously you can always call us if you have any questions.
Okay.
Okay,
Okay. It
okay.
seems
Is it? Oh, I'm sorry.
it seems great, doctor. But doctor, I have a problem with my kidney. Is it
Mm.
like related to this procedure? Should I do like this procedure? I have really problem with my kidneys.
Mm. It depends on what kind of problem you have with your kidneys, and it depends on how much is your kidney functioning. Because we inject some materials that need to be excreted. We need to be, like get rid of by the kidney.
Mhm.
And if the kidney is not functioning in a certain level, then we might need to reconsider it. But yes,
Mhm.
okay.
I will think about it.
Yes. Also, I just might need to ask you some questions, Mr. Hugh. Looking at the fact that you might have some heart condition,
Mhm.
do you smoke?
I stopped smoking.
That's great. And what about alcohol?
I don't drink.
You don't drink.
Mm.
And do you do any? Are you an athlete? Do you do any sports?
Ah, I like yoga.
Okay, yoga is okay. It's not an aggressive sport. That's what I highly advise that you avoid any aggressive sports after the procedure, as I said.
Okay.
What do you do for a living?
For a living, I'm a student.
You're a
I'm a master
student.
student. Yeah.
Okay, and do you think you might need some sick notes for the procedure?
Actually, it will be great. Why not?
Okay, I think
Yeah.
we can help you. We can help you with this,
Yeah.
with this matter. Um,
Okay.
do you think that there is anything else that I should have addressed or anything that you want me to talk about?
Actually, I will think about the procedure again.
Mm.
Yet, I have a lot of things in my mind. I don't think I will gonna proceed with this procedure really. I don't think.
We can always give you time to think about it, as I of course will give
Yeah.
you all the leaflets and the information that you need. um and you can get back to us for any questions, and we can arrange another meeting with my senior
Mhm.
colleague
Okay.
to answer any questions that you might have, and they might have more informations to give you. Would that be
Okay.
okay?
Okay, doctor. Okay.
Okay. You might need to sign some papers before the procedure, just acknowledging that you are aware of all this conversation that we've had.
Okay, okay.
before the procedure. Okay.
Yeah, I will think about it. I will
Okay.
think.
All right. I just want to let you know that it's very important for us to do this procedure to be able to put a plan of management for you.
Okay, okay, sure,
Okay.
sure.
Thank you.
Okay,
Thank you.
time is up. Sorry. Thanks, Dr. Rimaz. Yeah, perfect one. I added the consent in the chat box just to remind you again. It's
Yeah.
like cornerstone of procedure. Consent in procedure means that the mark for this scenario. So I'm
Okay.
trying to do something you might remember in the exam. So I put it in the chat box just to remember it if you face a procedure scenario. Dr. Roda, you can have your comment, then I will comment.
Yes, you did great, Dr. Rimas.
Thank you.
But you should be like in the introduction, you haven't said for him like we want to discuss issues related to your health, and you haven't asked him about his level of knowledge about his disease, and regarding the procedure itself. Uh, First of all, you should start with why this procedure is important in his case, and like the definition of the procedure itself,
Mm.
and then before, during, after. You said everything, but not like in
All of them.
yes,
Mm.
exactly, like
Mm.
before, during, after, and
Mm.
then you should at the end to tell him, okay, okay, Mr. John, or whatever his name. Are you on the same page for the procedure? Do you agree for the procedure? Because this took time. Yes, he doesn't agree. Till the end, he doesn't agree. You should ask him. And good, you open the issue of the consent. And when in any procedure like this, usually you have to open the issue of the die. Okay? It
Mm.
will not be like said frankly in the task that will be done with a die. No, this will be like a something hidden. You yes, and stick with the pre, during, and after, and you give a safety netting. For example, after the procedure, that if you feel like any pain, any like bleeding that is not stopping, any kind of increased body temperature, any change color of your limb, for example,
Mm.
go to the emergency, call us, call 911, any whatever.
Mm. Okay. Yeah.
And always at the beginning of any procedure, say why this procedure is important in his case, and this is for his best interest, and explain, and give a definition for the procedure. And he said, you, is there any alternative? Yes, there is alternative. As you said, you did it great. You said, yes, there is alternative, but this is for your best interest, and it is the best to see exactly in detail what is going on inside your heart chamber and your blood channels. Um, uh, yes, if you have time, you can ask about social issues like smoking, driving, because he cannot drive after the procedure for a few days. And I think this will be like already explained, might be by the cardiac team, but I think you should open the issue of driving here. Uh, because after the procedure, he needs someone to drive him home.
Yeah. 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 Yeah.
You
I
did it
think
great.
this is for
Thank you
every
again.
procedure.
Mm,
Mm.
Thank you.
Yes, you're right. Thank you.
Yeah,
Bye.
thanks, Dr. Roda. Great, Dr. Rimaz. It's great
Thank you.
and perfect. I will tell you the cornerstones of any procedure scenario, and there is some cosmetic, okay, just to
Mm.
make yeah the scenario like perfect, and you will get the full mark. So the cornerstone, this patient at the procedure, I mean any procedure, remember always drawing, 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 drawing.
Mm.
One first and second and third step, drawing. You have a
Mm.
paper. Let me draw for you, Mr. Jones, what we will do. This is not the beginning, but I mean, drawing will ease the scenario for you and for him, and it will make the explanation much better than
Easier.
just
Mm.
imagining. This is one of the cornerstone. The second is the consent. Okay, it's very important. And as Dr. Roda said, the safety netting at the end, you can add it. But this is the cornerstone. Okay, let's start from the beginning as the comment. Introduction, then invitation, no need here. The knowledge, the expectation. I don't know why also you didn't ask what your expectation. It's okay, you can ask what your expectation. I know I will not do any procedure anymore. You can ask any expectation, okay? Remember these four things: introduction, invite or next of kin according to the scenario, permission or next of kin or invitation. The third is the acknowledgement, and the fourth is expectation. This is the first line. You can spend around 3 minutes in these points. These points. One is introduction, then the invitation or confidentiality or permission according to the scenario. So, for example, suicidal, you are sure here for confidentiality. HIV needle stick confidentiality. HIV related also patient confidentiality. Okay, patient with the son of the patient. So this permission and next of kin. This is alternative. Counseling about disease, invitation. I can invite someone because he might be shocking news, breaking bad news, patient death. I can invite. So these 4 points you will play on the introduction and invitation, acknowledgement about the condition and expectation. This is the first 4 things. Second thing, the explanation. As Dr. Roda said,
Sorry,
in this
can you
procedure,
say them again? So mention the confidentiality, introduction,
confidentiality,
confidentiality, ideas.
uh, yeah, and idea about the disease or knowledge about the disease
Mm.
and expectation. Confidentiality
Expectation.
in certain condition. In another condition, invitation. If you talk
Oh,
to the
so if
son,
it's confidentiality, then no invitation, and if it's invitation, then no
yes,
confidentiality.
yeah, I
Okay.
am saying there is
Mm.
different scenarios. Either
Yeah, yeah. Mm.
invitation for counseling about disease, but not inherited one, not familial disease. For example, you will talk about SLE. It's not inherited, so it's okay. You can invite her sister, her brother, her husband just to support her. But if Huntington, you can't invite someone for Huntington disease because it's familiar disease and you don't you don't want to spread the news about the patient, right? So
Mm.
it's a confidentiality point. And invitation, when you have patient, for example, breaking bad news, death, cancer, coma, so a complication, major, serious. Okay, this is for invitation. You can invite. And the third thing, the permission. If you have patient in admitted and you will talk to his son, you assume that you have permission from his son. So this is the 3 different things you will do after introduce yourself. Either invite, if general counseling about disease, or the second thing, confidentiality. You assure for confidentiality like needle stick or HIV or Huntington or familial disease. And the third thing, the permission. If you have talking to the son or the daughter or whatever.
Mm.
Then the idea about the disease, as you said, and the expectation. This first thing. For the procedure indication, you explain and the indication. You have a heart disease, and the indication that your heart need to be assessed, measure the pressures inside the heart chambers. Then finish the indication and the explanation, the disease and the indication. Took it in a stepwise manner, as Dr. Roda said, before, during, and after. Before, during, and after. Before, during, and after. Before, if you ever took any blood thinning medication or blood thinning medication, we will be sure that no affection of your bleeding profile, either by some investigation, by workup, and we will stop your bleeding or blood thinner medication. This is before. What else before? We will not admit you. We will just have a daycare or whatever the procedure, endoscopy unit, uh, whatever like here catheterization unit. So this is
Mm.
before. Okay, during numbness, I will be sure that you will be numbed. The pain doctor will see you. You will not feel pain during. and will be clean inside the theater, clean skin, the scar, the wound, as you said, the wound of the incision. But the incision is jargon. So the cut, we will go through a cut, small cut through your skin, and the catheter or the wire will go through the blood channel into your heart, then measuring the pressure and so on. This is during. After, we will be sure that you are under good observation, nothing happened, no complication, and the vitals, and looking after you before going home. And we'll be sure that you are okay, you can drive safely, or someone take you home. This is for during, before, after, for during, after, before, during, after. Don't forget the complication. Now the role of complication. There are some complication which are few.
Bullet complications after.
Yeah, after, because
Makes sense.
that's why I'm mentioning after. Yeah, but
صح.
try, yeah, after. Okay, so what are they? Two eyes, some I don't know who's the mentors created. Two eyes, 2B. Two eyes infection and injury. Eye infection, eye injury to nearby organ. Eye infection, eye injury to nearby organ. 2B bleeding and perforation. Bleeding, perforation. PB, BP, bleeding,
Anyway, he didn't give
perforation.
me the chance to finish them. He didn't want to talk about the complications, I
Yeah,
think.
it's
Yeah.
important one. Yeah.
Yeah.
So the nearby organ injury, either by the needle, by colonoscopy, by LP, lumbar puncture, whatever the procedure, pacemaker, and failure. You can put failure in any procedure, SNP, LP, pacemaker, catheterization, failure. I couldn't reach, I couldn't do. There is some failure in the theater room, failure. It might not happen because of certain technical issue. Okay, so put the failure as one of the complication. He addressed the death as a complication. Might happen. I'm afraid to say it might. However, we assure you it's very few percentage to happen. Our professional and expert team take care of this, and they are doing the procedure million or many times for daily, and they are expert in this. So this can happen because of perforation. So you are not lying. It's real. If the heart perforates, for example, or the chamber, or whatever the procedure is, it might fail. It might lead to death, and this is one of the complications. However, it's very rare and very few. Okay. Alternative. She asked you for the alternative. Whatever the alternative is, don't talk about unless there is a task about the alternative. If no alternative in the task, don't say the alternative. Don't mention it. Yeah, there is alternative. Any procedure has alternative, but this is not your task. If you go from this session uh, giving an option alternative to the main task, you will fail. For example, this patient for characterization, and you told him there is transesophageal echo you can do, and it's better, it's magic, it's whatever, you will fail. Your task is to convince for catheterization. This is your task. So don't give another option from your mind, which is not mentioned in the scenario. Yeah, there is alternative, but as you said, it's the best interest for you, our procedure, which is catheterization. Okay. She asked you for the pain. Yes, we will be sure that you don't have any pain. Our pain management team will be sure about that. Pain management team means anesthesia, but I will not say anesthesia because anesthesia is jargon. So pain management team, the pain management team, okay? And the consent at the end, here you are. This is the consent. Read it well, carefully, and at the end, you will sign in the sign area, and be sure anytime you want to withdraw, it's your right. You can withdraw. Clear? Then it will offer him leaflet, brochure, website, safety netting, as Dr. Roda said, if any bleeding, if any drop of, sorry, if any dizziness, if you feel bleeding from the site of injection, if you feel your eye dark, sorry, yellow, if you feel your waterwork dark, means that he has some bleeding or anemia, I mean. Then, if you have time, of course, for the smoking, alcohol, support, and the job, and the driving. Driving is very important in some procedure. For example, LP, PCI, the catheterization, angioplasty, epilepsy, and LP. So try to offer or to ask about driving and the safety to drive after the procedure. And better to make like the perfection, to tell him if you can, someone take you home, or if you don't, we can arrange that. If you have someone to take you home, or we can arrange for that. And
Okay.
yeah, that's it. No more. I think the time will be already up after all these things.
Yeah.
So the procedure means or equal to draw. You have a paper, you have pencil, just draw a heart, even simply like for chamber, not complicated heart like the real one. Just some near to the real one, four chambers, the blood channel in the leg. Do whatever you want to do. Just make it simple as much as you can and as much as the patient or the surrogate can understand. Don't make it complicated and draw a gene, chromosomes, and so on. No, it's just be simple. Okay? Be
Okay.
simple.
Yes.
Yeah. Okay. Any question or any comments? I I talked today lengthy. Sorry for being that talk.
No, that was very helpful.
Yeah,
It is
please,
really
please,
helpful.
Dr. Rimaz, try to write your weakness point in a paper
Mm,
today and
yes.
revise them. Revise the topic we talk about, celiac and the cancer or COPD or bronchiectasis, the point of inflammatory, sorry, functional, and the point of procedure. Tomorrow,
If I can add,
we,
yes.
yes, sure.
Yeah. Remind me with myself. I was confused every time when I'm just trying to talk about the procedure or just communication. Just I want to tell you that just the same introduction in clinical communication, you use it in the procedure, except the point Dr. Basim told you that the confidentiality area, but the same. Till you come, our team has run some investigation or plan to do some investigation for you. At that moment, you talk about the procedure, but all the introduction is the same. This is one point. Actually, they kill it. When they are talking about during the procedures, this is the time you draw for the patient.
Mm.
The complications, we have general complication, as Dr. Basim said, and sometimes there is a specific complication, like in this case, kidney impairment. It could be from the diet that you are going to use or from cholesterol emboli. So in the complication, all the time, there is general, this is the 2 B's and 2 I's, and the specific. Think this way. And she kept telling you all the time, yes, I'm afraid, I'm scared, I'm afraid. And you have to assure her.
Mm.
You tell her that this procedure has done many, but will be done by specialized doctors or team who have done it many times. And even when you talk about the complication, and if this complication is rare to happen, and if it is happening, they can deal with it right away. Just to reassure her. Otherwise, everything is covered well, and you did well.
Thank you
Yeah,
so much.
thanks, Dr. Hanan. Yeah, the dye here is very important point, and it was raised by the surrogate. However, it's not common in the normal kidney patient. So if the patient has impaired kidney, maybe he's the one raised it. If no, I
Yeah.
guess, yeah, it will not be raised unless he will do it. The other thing, yes, the specific complication for LCC, yeah, according, you can think about it before going to the station, Dr. Rimaz, you can put a skeleton, even words. Every point you can put a word. Introduction, the name, of course, the name. Don't forget the name, because if you go there and you're not remembering the name, or You can ask about the name, but it will be also against you that you are not remember the name. Better to write the name and the age at the top. Then the introduction line I told you about. Then during, before, after. Then the red flag or safety netting at the end. Social at the right side. And the middle you can write or the draw or just make a skeleton for what you will talk about. For example, before and during and after. In the disease itself, you can write indication, pathology. We'll mention this tomorrow. We'll explain. But for example, you will say the indication, the pathology, the manifestation, the complication, the management. You will put these words like titles you will talk about. Tomorrow we will have a talk about this counseling of disease. I don't want to make it more lengthy. Tomorrow we'll repeat our today practice. Dr. Imaz will be the candidate and two surrogate for the long and two surrogate for the communication. I guess it will be the last practice day for you because Friday we are off.
inshallah. Yes.
So we'll make it condensed for you. We can prepare high yield topic as long and some also other high yield topic in the communication. Yeah, I
Okay.
will end the recording to denominate for tomorrow. Thanks all for the attendance.
Thank you so much. Thank you so
Most
much, guys.
welcome. Thank you, Dr. Imaz.